My name is Binia Mayel. I'm a researcher focusing on brain health and dementia and Alzheimer's disease, how to prevent, strategies and care for patients with dementia, as well as ways that improves caregivers, how they could cope up with caring for their loved one living with dementia. So for now, I'd like to talk about what is difference between dementia and Alzheimer's disease. Most of the time, these two diagnoses and terms are kind of used interchangeably, but they are not exactly the same, but they do have some relation. So when you say dementia, dementia is an umbrella term, syndromic term that indicate there is some decline in cognition, could be language, behavioral, or any navigational problem that affects our daily livings. So whenever this kind of memory problem and other cognitive decline start to affect our daily living, that can be diagnosed or can be described as dementia. While Alzheimer's is the commonest cause of dementia, so almost 60 to 70% majority of dementia due to Alzheimer's disease, but we do have other various causes of dementia. Just Alzheimer's is the commonest cause of dementia so far from scientific evidence. That is one thing. The other thing is principles of brain health, how we can have a healthy aging, we can keep our brain healthy. In that case, there are a lot of principles, a lot of behavioral factors that affect our brain health: lack of sleep, hypertension, diabetes, hyperlipidemia, lack of exercise, obesity, trauma to the head. So there are various factors that could affect. Mean that if we are able to prevent those factors, that will help us to have a healthy brain that could age for a long time without much of a problem. So it's important to be familiar with this kind of risk factor. We call them risk factors for dementia. Almost research currently indicate that almost close to half of dementia can be prevented by intervening, identifying and treating these risk factors, including literary education, hearing loss, visual loss, trauma to head, traumatic brain injuries, by preventing hypertension, diabetes, dyslipidemia, obesity, smoking, alcohol. All these are so far been identified as some factors that could contribute to onset of dementia. So it's important to take care of these factors and to stay healthy so that we can live a longer, healthy, aging brain. So for now, this is as my work and research kind of focus on this area. This channel is, I like to improve public awareness to our dementia, Alzheimer's, and other factors that could help us to stay healthy. And I'll see you in the next video.